Hi everyone, this is the video on forensics and sexing. Just like with all of these before, you guys know, you can follow along with the PowerPoint and or watch the PowerPoint later, listen to me now, it's really up to you. But we're gonna jump right in. So on this PowerPoint and this lecture, we're gonna be talking about sexing, so how to determine male versus female. And we're also gonna be talking about some different forensic techniques such as how to determine like stature, how to determine age, and we will be doing some really cool fun exercises in the lab. But just like with the other stuff, this is a nice overview of some of these concepts, so when we get into the lab we can get into all that hands-on fun stuff. So if you're following along in the PowerPoint, you'll see actually that the first couple of slides are similar to the slides that we just had on the introduction to the human skeleton. So as you'll see, once again, you're seeing the picture of the calipers. Now I can actually show you what they look like now that I'm in the lab. So here we have, these are the spreading calipers. So like, you can measure things that are large and round, or we have the sliding calipers, and these you can get into the little, nooks and crannies of the skull. So we will definitely be doing an exercise in class where you get to use these. Most likely I think just this, maybe this. It depends on which measurements I have you do, but you'll get to use those in one of the exercises, so it's pretty cool. So like I said, some of this is reiterating from the previous PowerPoint, but you'll see on the slides we've got that list of features, or what's the word I'm thinking of? Different aspects you can determine based on measurements from the skeleton. So age, sex, ancestry, pathology, stature. So stature meaning someone's height. A lot of visual methods to determining someone's pathology, or like an injury or a disease, and of course sex. So we're going to get into those. So the next slide says cranial landmarks, and you will see those two images side by side of a bunch of different arrows and words and stuff. Basically this is pointing to what we call cranial landmarks. And just give me one second. So on the skull, and you're gonna, you have already been able to look at these in class at this point, and you will continue to, really for the rest of the semester looking at bones, right? But here we are still dealing with the human stuff. So cranial landmarks are very particular points on the skull that are standardized. So if I were to use them, or another scientist were to use them when we can compare our research, we know we're using a very standardized way of taking measurements. And this is important, so when we compare, we're not just comparing completely different systems and being random, like, oh, you have your own areas that you have names for and I have my own areas. It doesn't really work that way, right? It's better to have a standardization. So basically, whenever there is a suture that meets another suture, we talked about these before, the suture lines, correct? When there's a point where you see they meet, we call this like an intersection. We almost always have a name for that exact point where they meet. So you could see like this one where the sagittal suture and the coronal suture are, we call this bregma. There's a very specific name for that exact point. So if I were to say, oh, in my research I collected, bregma from a bunch of different skulls, anyone else coming along and wanting to repeat my research or wanting to just understand it would know, oh, she's collecting from like that exact point, right? And then there's a bunch of other names. We have asterion, nasion, prostheon, right? So they all have names. Now you're going to be doing an exercise in class where you're going to be using this, a worksheet, and you're going to be using this, the sliding calipers, and you're going to be looking at an image on the worksheet with some of these cranial landmarks. And this is just to introduce you to this idea that we can use these standardized, landmarks. They all have names. They mean very particular points on the face or the skull, and then you can, use these to have measurements, from one point to another. So that is what that particular slide is talking about. The next one goes into also what we had discussed on that intro to the skeletal system, which is fine to reiterate a few things. It's totally fine. This is just going to get in your head a little bit better, right? So recall that we talked about the skeletal system being both bone and cartilage. We store minerals in our bones. This is also the site of blood cell formation, so just to remind you of some of that. Moving along, let's see. Oh, I had there's a slide showing, actually this is kind of a personal story, and we have a little time, so I'll share. So going back to that idea that the bone is where, we create these blood cells. When I was going through my treatment a few years ago, I had a very low white blood cell count. Now, that happens obviously when you're going through chemotherapy, but mine was even like lower than it should have been even as a cancer patient. And so I had to do these injections, and that's what that image is of these injections I had to do. And it stimulates very, very quickly the blood cell formation. And so because it's taking place in your bones, like let's say your leg, the bones of your legs, the doctors told me, this is going to stimulate this process. And so you're going to have a lot of leg pain. And it was just this really interesting experience to obviously be uncomfortable and in pain and going through treatment, but to be so aware of like the functions of your body, very interesting. Okay, so moving along. Next, the skeletal sections. You guys know this, right? Axial versus appendicular. So we had gone into this before. We had the whole lecture on axial and then a whole other lecture on appendicular. So the bones for each, appendicular being like your appendages, your arms and your legs, and axial being that middle part. We talked about that. Next slide, deciduous teeth. So we are going to talk about teeth a little bit. We did talk about teeth before. We'll probably bring it back to it. But really, I want to make the point of that teeth are really good for aging. And so you can see here the image, which is just kind of crazy, of what it looks like when an individual has like their baby teeth, but the adult teeth are forming like up inside, like the maxilla and the mandible. It looks really crazy, right? And so the teeth are a really good area to be able to determine age, more so than probably any other area of the body, like in terms of the skeletal system. With the teeth, they erupt at a very particular rate, a very specific rate for us as humans. So if you find an individual who's under like 21, then based on their teeth, like which baby teeth are still there, which ones are gone, which adult teeth have erupted, you can determine someone's age within, give or take a couple of months. After their wisdom teeth have come in, so their third molars, then the age ranges that we can determine an individual to tend to be a little broader, 30 to 40 or, 40 to 51 or something like that. So once, like I said, if you still have the teeth are still kind of going through their developmental process, though, you can be really specific within like not even just years, but down to like the months, like 6 years old plus or minus, 2 months, something like that. You can get very specific. Next slide, age determination. So just kind of continuing that discussion on age determination. So other areas of the body. So there's a little list on the next slide. Degenerative joint changes that we're going to see in these 3 areas: the pubic symphysis, the auricular surface, and cranial sutures. So the pubic symphysis we did talk about briefly when we were talking about on the appendicular lecture, talking about the pelvis, right? So now we're going to reiterate some of those features of the pelvis when we talk about sex determination and, of course, age determination. So I have a few examples here I'm going to show you, and you'll be able to see these in class. They're going to be labeled. You're going to get to work with these. You're going to have hands-on experience, but I'll give you a little preview of some of these right now. So going to the next slide, the pubic symphysis. So let me just give you a reminder. Okay, sorry, off screen. Okay. So here is the pelvis, right? We've talked about the pelvis before. Here is the pelvis, and you can see, like, this is the front, right? This is the anterior portion, and here we have a little bit of, rubber kind of representing the cartilage that's right there. But if you took that cartilage away and you looked at that area of the bone on either side, basically where they would kind of be connecting. So here I have and remember this bone right here is called the pubis. I have a few actually, a pubis right here. So let me see if I can do this. So here I have just the pubis. Does this make sense to you guys that I'm looking at this bone right here, right? Obviously a slightly different shape. Every individual is going to look a little different. But here I have this part of the pelvis, right? So I'll put this big piece down and we'll look at this. So now we're looking at just the pubis. If I turn and rotate it, which is how I described it to you guys before, and you're going to see, let's see if I can get that camera to pick it up. You can see this area and how there's a lot of, nooks and crannies to it. This is a really good area for determining age. when an individual is young, as you will see on the slide, it's kind of giving you some of these features you'd want to look for. When an individual is young, here's a really good example of someone who's young. There's going to be what we call a lot of billowing. Billowing, you can see here, is this kind of like waviness, you know, to the bone. It's this nice like waviness to the bone. And then the rim or the edge is nice and clean. That's like a dead giveaway that you're looking at someone who's young. When someone becomes like middle age, it looks a little more like this first one I showed you. It's kind of flat in some areas. That billowing, that nice kind of soft flowingness to the bone, that's not really there anymore, but there doesn't seem to be any kind of large holes or anything. The edge is still pretty clear. There might be the occasional little area that's maybe starting to be a little like, it's lipping a little bit or protruding slightly. And then I don't have the old one. You'll see that in the lab. And when someone's old, it's a lot more deterioration. So you can determine even some general ages as like young, middle-aged, and old. And in the worksheet for class, you're gonna actually be doing that, looking at the different pubic symphyses and just determining like young, middle, or old. That's like fine for this level, right? And if you go to the next slide, you'll see on the auricular surface. So the auricular surface, so here we have the pelvis again. Here's the back, this is the sacrum, right? So here's the left side of the pelvis, here's the right side of the pelvis, and then here's the sacrum in the back. If I were to take the sacrum and remove it, you would see right here, like these areas where it's attaching to the pelvis, you would look at that area on the pelvis, and very similar to what you would see on the pubic symphysis, you're gonna be looking for those similar features, right? Slightly different, but you're looking at billowing, you're looking at whether it's fine grain or coarse grain. So that's really like, what is the texture of the bone, you know? Is it, does it feel like sand, kind of fine, or does it feel more like rough? So that's usually young to old, right? And then also on the auricular surface though, you do look at what we call stria. So typically there's these kind of lines that you'll see when someone's younger versus when someone's older. So we're not gonna look at that one in class, we're just gonna be looking at the pubic symphyses, but just so you know, there are different areas of the body where you can determine, you know, at least in a general sense, you can look at the aging process. So the next slide, the cranial sutures, which I've already kind of described to you, but I'll show you another skull that we have. So here we have, again, you can see, oh, these are a little more clear. You can see these cranial sutures, right? We've talked about the cranial sutures before. There's a few that you have to know for class, right? So like the sagittal suture, the coronal suture, you know, we've got the, lambdoid suture, what else did I have you know? Like frontonasal suture, right? So it's on the list, you guys know. So you're familiar with what these are, right? Remember, they're joints, they're fibrous joints. Now, what do I have on the slide? Oh, yes, so in general, you can look at these sutures to determine someone's age, like once again, in really broad categories, like young, middle age, and old. Typically, I don't, where did I put it? Oh, it's on, hold on. Okay, cool. It's like, I thought I had it somewhere. So when someone's very young, so I have a little, give me one second. So I have a fetal human skull. You can see what this would look like. Now, in terms of the cranial sutures, remember, all of these bones of the skull, it's not just one big skull bone. We can see that even when we're looking at like a fully formed, like adult human skull, you see the lines where those bones are connecting with each other, right? That's what the suture line is. And when you're looking at a fetal skull, you can really, really see the separation of these bones where they're not even, in some areas, not even fully formed to connect with each other yet. There's still this process is occurring, right? And sometimes there can be what we call like a soft spot. You guys have probably heard of that, right? When an infant's first born and you're holding it, you have to be very careful. They say, oh, be aware of like the soft spot, right? There's usually a big one on top of the head and maybe a smaller one in the back. It's literally what this is. And we call this a fontanelle. 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 That's like the technical term for a soft spot. And basically, it's an opening. So literally, when these individuals are born, this area, there's no bone there yet. That'll happen very quickly after, like once they're around for weeks or months. That'll start to turn into bone and fuse, and you'll get the suture lines and all of that. But initially, it's just like, probably a little bit of fascia and like some skin. You really do have to be very careful. There is no bone there, right? And so you can see that on this individual. So in terms of someone being young, you're going to see this openness to those bones. You're not going to see nice squiggly, suture lines that we see in adulthood. You're going to see very open areas like this, and or a whole area that's called a fontanelle. Now you might be thinking, well, obviously this is young, it's so tiny. Of course, right? But if you had a fragment or something, like, oh, this looks like a skull fragment, and you saw that the lines were very open, you would probably be able to determine you're looking at someone who's exceptionally young, right? If you have the whole skull, you can use multiple things about it, that it's small and all that other stuff too. Okay. Now when someone is aging, there's that aging process. Those lines are going to start to form, those bones are going to close up. You're going to get those nice suture lines that we see in adulthood, right? Now, most of the time they will look like this. They will be nice and kind of squiggly, and depending on what area of the skull you're looking at, they're going to look a little bit different. Every individuals will look a little bit different. And you can typically determine someone's age by just generally looking at the sutures. Like, okay, like I said, are they open? Someone who's young. Do you see them really obviously? Someone who's obviously going into adulthood. As someone ages in adulthood, however, these lines will start to fade slightly, and typically in very particular areas. So you might see, at bregma, onto the sagittal suture, it might start to fade at like this first part or the midpoint. There are certain areas, and if you were to take an advanced osteology course, you would get into exactly where to look on the suture line to be able to get a more precise idea of how old that person is. Like, oh, if you look at the midpoint and it's faded, they're at least, 35. You can get really specific, but in terms of this class, what I want you to know is that open means you're very young. When you see a nice clear line, you're into probably early adulthood. If certain parts of the line are fading a little bit, that's probably later adulthood. Now that will be the case for most people even in a later stage of life, 70, 80, 90. You will still see the line. There might be a little fadedness in a few points, but you will still definitely see that line. You will notice though on the PowerPoint I've added on that third image down where there are 0 suture lines. You can't see anything. This is something that is rare. I put it there because it does happen, and it's very interesting that when there's full closure of the suture, and when that does happen, it is almost always someone who is older. But I just want to reiterate that for just the most people, when they get to an older age, you are still going to see that line. It might be, like I said, a little faded here or there, but you will still clearly see that suture line. Okay, next slide. Okay, now getting into sex determination. Give me 1 second. Okay, so let's go over a couple of things first. So the next slide. Let's see. Oh, the first bullet point. Homo sapiens are what we call a sexually dimorphic species. Homo sapiens are sexually dimorphic. Now, sexual dimorphism is a concept we're going to talk about for the remainder of the class. We're going to get into it with the primates for sure. We're going to get into it with the other hominins, and we're going to continue to talk about it in terms of Homo sapiens. So sexual dimorphism is when there is a difference between the male and the female of the same species based on size, shape, or color. Some species, it might be all 3. Some species, it might just be 1. Some species, they don't have sexual dimorphism. We would call them monomorphic. So sometimes you can't tell if you're looking at a male or a female of a species. You have to look at their genitalia. So a really good example of a species where they have no dimorphism, where we would call them monomorphic, is like a house cat. Think of a house cat, right? You can't tell by looking at a cat if they're a male or a female, right? You have to look at their genitalia. It's not as if all the bigger cats are male and all the smaller ones are female, right? It doesn't work that way. Or all of the black house cats are female and all of the orange house cats are male, right? Color is unrelated, right? What did I say? Size. Oh, and shape. The shape differences in the skeleton. Typically, we mean like the skeletal system. are going to be, there's not going to be any, right? So you'd have to literally look at their genitalia to be able to determine if you're looking at it like a male cat or a female cat. So some species in the world do exist where you just can't tell, right? You have to look at their primary sex characteristics. But there are many, many, many animals that you can determine male versus female by simply looking at them, right? So some, let's say like bird species, you might notice there's a color difference. Oh, the males are the one with all the elaborate coloring. The females are a little more plain colored, but maybe their size is approximately the same, but the color difference is very different. So for some species, the dimorphism might just be color, or it could be color and size, or it could be shape and color, or it could, it could be one or two or all three. So humans are what we call moderately dimorphic. We have a moderate amount of dimorphism, kind of similar to a chimpanzee, where you can absolutely tell the difference between the male and the female, but we have a size and shape difference. So Homo sapiens, we do not have a color difference, right? Males aren't blue and females are pink or something like that, right? That's not how it works. But we do have a size difference in a general sense, and a shape difference. So this very specifically means like the skeletal system. You can absolutely tell a male versus a female by looking at the skeleton. The best areas of the skeleton to have are the skull and the pelvis for hopefully obvious reasons. The pelvis, obviously, because evolutionarily the female pelvis has been, selected for it to have like larger openings, especially where like the pelvic opening, the pelvic inlet or outlet where their offspring might be passing through, right? Males, it doesn't have to necessarily be big because there's no offspring passing through. So you're going to see big differences between the male and the female pelvis. And then even in the skull, we see a lot. So males, compared to female humans, they have a lot more like upper body musculature. It's larger. And so in the upper body, so this includes like the chest and the neck, and a lot of those muscles come up and attach like onto the head in the front and especially in the back. So the bone will respond to that. If there are larger muscles attaching to areas of the bone, on the bone you'll see what we call bony markers, where you can see, oh, that's where this muscle is attaching, and that muscle will look a little more rough or rugged, or it will be a larger area of rough or ruggedness depending on if that muscle is larger, So those areas of the bone will look more rough, rugged, more protruding, longer, wider in the male skull than the female because of the muscles, right? So going back to the slide though, so this is just important, like I said, that first bullet point, that humans are sexually dimorphic. You can absolutely tell the difference. Like I said, primary sex characteristics are genitalia. Secondary sex characteristics are all of the features that occur during puberty. So for a male and a female human, you can't tell the difference skeletally until they go through puberty. If you had like a 6-year-old female skeleton and a 6-year-old male skeleton, you would not be able to know the difference. Trust me, people have dedicated their careers, written, their dissertations on trying to find if there's a methodology that we can use to determine sex on a prepubescent human individual, but it just doesn't exist, right? So no surprise though, right? So all of those differences that we think about male, female, like body, soft tissue, bone, whatever, those are all happening at puberty. So the bone structure will change in like the pelvis for the female, male muscle structure will shift and change, so all of the bone will respond to that. And like I said, we have a moderate amount. So other species, which when we get into the primate section, we'll talk about this. Other species that have a large amount, like a really good example is the gorilla. So the gorilla male is average around like 400 pounds. Female gorillas are around like 2 to 250. So like literally almost twice the size. Shape difference, massive shape difference in the skeleton, in the skull for the gorilla, which you will see in the primate section. And then also there's a color difference, right? We have silverback gorillas. So gorillas are a really good example of when there's a high amount of dimorphism, a massive difference between what the male and the female look like, right? And in the gorilla, they're using all three, size, shape, and color, right? So humans are kind of a moderate amount. Chimpanzees are another good example of a moderate amount, So like I said, as we go through the primate section, we'll talk about more examples of that, but just know as we're introducing it with this section on the human skeleton, there are differences between the male skeleton and the female skeleton. We are a sexually dimorphic species. That second bullet point, it is also very important to understand there is a big difference between sex and gender in terms of terminology. Now, in this class, this is the biological anthropology course. So we're only talking about sex. We're talking about like developmental processes, hormones, reproduction, gestation versus insemination, all of these features of the skeleton we'll talk about. So we're talking about sex, right? The biological differences. Gender, if you take the 101 class with me, we get into gender. Obviously, this is how, now here's the other thing about gender, right? Depending on if you're taking an anthropology course or a sociology course, there might be different definitions. You might have your own personal definition. Society might have its own definition, right? So typically we reference gender in anthropology as being like the rules kind of regulating how you're supposed to behave as a female and how you're supposed to behave as a male given your particular, cultural scenario. But this term has definitely evolved, like in pop culture. You could say, oh, well, we kind of view gender as kind of self-expression, right? So obviously you understand, like, this is a very interesting and complex conversation that you would have in another course, intro to cultural anthropology, sociology, something like that. In this class, we're not talking about any of that info. It's just not what we talk about. We're talking about just the biological, like anatomical, morphological differences. So we use the term sex. If you use the term gender in this class, it is absolutely incorrect. Those are not the same thing. I know sometimes we feel the need to say gender because people don't want to say sex, but we're all adults, right? We're not talking about the act, and even if we were, because we do talk about reproduction in this class, we're all adults. We should be able to talk about that. You should be able to say some of these words without it being a problem. And so we're not even talking about that. We're talking about just like actual male versus female. So saying the word sex is the correct term, and you should definitely use correct terminology. I will absolutely call you out on that. Not to be mean or anything, but I will definitely point it out in class if I see you write it or I hear you say it. So moving on to the next slide, you're gonna see we've got, like I already mentioned, the two areas of the skeleton that are best in determining male versus female. It's the skull and the pelvis. And so if you go to the next slide, you will see the traits for the pelvis, and it looks like there were 6 traits. These are just 6 that I'm giving you for this class. There are more, but these are just some of the more obvious traits. And I'm pretty sure I have a slide for each of these. And so we will go through these, and I have a male pelvis and a female pelvis, and I have a male skull and a female skull. So I will be able to point these out to you. Now, even on this video, hopefully this will make sense to you. And then in lab, you will be able to kind of look at this and hold it and move it and compare it. It'll be a lot easier. Okay, so let's go through this list. And like I said, the ability that you guys have on these videos to pause and stuff means I can go pretty quickly. So the first feature, the pelvic outlet or inlet. So literally just this large opening, right? Which, wherever you're looking from the bottom or the top, it's this large opening. On a female, here's the female, tends to be pretty open, right? You can see. There we go. You can see it tends to be pretty open and wide. The sacrum back here, see how it's kind of curving and getting in the way a little bit of this opening? In females, the sacrum will tend to curve a little less because you don't want it getting in the way of any offspring that's like trying to get through. Here we have the male pelvis. You'll see this opening is much smaller, right? And you can see the curvature of the pelvis the curvature of the sacrum is blocking that entire opening, right? Nothing's coming in and out of there. And that's fine because nothing would need to. This is the male pelvis, right? So you can see just in that large opening, comparing major difference. The next feature, the pubis shape. So you guys know what a pubis is, right? It's this. This is the pubis. Now, if we're looking at the pelvis, right? So it's this front part right here, that's the pubis. The shape of this bone in a female and the shape in a male are quite a bit different. And you'll see in the image on the PowerPoint slide, the difference with that first image where it's showing that in the female, pubis tends to be more square or rectangular, and in the male pubis, it tends to be more triangular. So let me show you the more triangular one. Here's the male. So if we're looking at this bone right here, right, you can see here how it has that more of a triangular appearance. You're probably thinking triangular, what does she mean? Some of this is gonna pop out to you more in the lab. And here you can see that the pubis shape in the female is much more squared off. You can see it, it's really wide. Let me see if I can get a really good like side by side of these two for you. So you can see, oops, okay. Oh God, here we go, no. Okay, wait. Okay, there we go. So you can see on top the male and the bottom the female. Massive difference, right? You can see the female pubis much wider, definitely more square, rectangular. And then the image on the slide, hopefully you can kind of see the difference there. I actually have my image. I have a bunch of pelvic, well, really everywhere in my body. As you guys can imagine, I've had a bunch of imaging done over the years, the last few years. So when I can, I try to include that in these. So you can see mine are pretty rectangular, so it's a very female feature. Moving on to the next slide, the subpubic angle. So here we're looking at the pubis, the whole pelvis, right? And here's the pubis, right? Subpubic angle. So literally just this angle right here. So this is the front of the pelvis, right? This is the front. And in our bodies, it's not like this. It's kind of tilted a little bit. That's fine though. So this angle right here, literally just this angle. In females, it's going to be more open or more obtuse, larger than a 90-degree angle. And in the male, it's going to be more acute or smaller than a 90-degree. Look how tiny that is, right? Compared to the female. It's so much more open. Just that angle, right? Basically, the general rule is if it's wider, more open, larger opening, bigger space, you're looking at the female pelvis, not the male. The next feature is, I already mentioned this one, the sacral curve. So here's the sacrum, right? Here's the sacrum in the back. If you were looking at it from the side, you can see how much it curves. Male sacra will be way curvier. Every sacrum has a little bit of a curvature to it. You can't eliminate that completely. That's just how the bone is. But for the females, it's definitely going to be a lot less. Remember, so it's not getting in the way of any offspring coming in and out. The next feature, the greater sciatic notch. This is the greater sciatic notch right here, this giant opening. Now, in a male, let me show you the male. In the male, it's really small. You can see, I'm trying to get a good background so you can see the contrast. Let me see. Ugh, God. I'll just try to bring it closer. There we go. So here is the greater sciatic notch. Basically, you can fit, in a male, you can fit your thumb in there and not really wiggle it around, right? It's very, very small in the male. Once again, general rule for the female, if it's a feature that's bigger, wider, or open, here, like I can swing my thumb around. This thing is massive, right? It's huge in the female. So it's larger in the female, the greater sciatic notch. The next feature, the subpubic concavity. So we talked about the general angle, right? The general angle, but this actual line to the bone, does it have a little bit more of a curvature that's concave or more of a curvature that's convex? So you can see on this individual, I'll just move it a little, you can see this is a concave angle. It's concave. It's kind of coming in a little bit like this, right? Creating a little more openness. In the male, this tends to be more convex, curving outward, making more of a barrier. So you can see here, you can see this one actually, this one's a little more straight. This one's actually not too convex. This one's actually a little more straight. Natural variation exists, right? But you can see on the image there, the male versus the female. The female, it's concave, it's much more open. The male, convex, closing it off a little bit. Oh, something else I want to reiterate. This is actually very, very, very important. I'll probably say it a few more times when I think about it. In this lab, with these examples and the ones you're going to see in the lab, we are showing you, I'm sorry, the hiccups. I'm showing you really good examples of female and male. For most individuals, we're not going to be these extreme examples. There's a lot of variation, and remember, one of the main things about how natural selection and evolution works is that variation exists. Male, female, not all males look the same, right? Not all males have the same exact physical body features. Not every female looks exactly the same and has the same exact, skeletal features. Of course not. We understand that, right? What we understand, though, is that males as a group and females as a group are fairly distinct from each other, right? So if we were graphing this, it'd be like, oh, here's a cluster over here, and here's a cluster over here. Maybe there's the occasional little outlier, something random. But even though there's variation will exist amongst females, the groupings of these male and female are still going to be, very, very different. So that's important to remember, which is why, let's say I gave you a pelvis, and I said, determine if this pelvis is male or female, which you actually will be doing a worksheet on that. you would want to go through the list of all of the pelvic features. You would never want to look at just one, because you could be going through and saying, okay, that's a clearly obvious female feature, obvious female feature, obvious female feature, and then you look at another one and you're like, that's kind of like intermediate. I'm not really sure, right? If you'd only looked at just that one feature, you might have guessed wrong. So it's important to look at all of them. And then of course there's always the chance that just randomly on a female pelvis, she happens to have a little convexity to her, pubic ramus. Like it's random things like that can happen. That's just that's just variation existing, right? So you always want to look at all of the traits, whether it's the pelvis or the skull. You never want to look at just one, because all of us, it's not as if, let's use myself as an example. It's not as if every one of my pelvic features will be the 10 out of 10 hyper feminine example, right? The variation will exist for all of these features. So this is a really good example of a very large greater sciatic notch. But you might have another female where it's only about like 90% of that, or 85%, right? There's going to be a little bit of variation. So just keep that in mind when going through these. You never want to look at just one. You always want to look at all of the features. And also I want to point out, this is important, and I feel like I explain this to the students usually, and I don't really know if they're grasping this, so hopefully I can make this clear. When we use the words like female or male, or like, I should say more like masculine or feminine to describe some of this, like this is a very feminine trait, this is a very masculine trait, that is not a value judgment on the attractiveness level of that individual. I hope that's very clear, because unfortunately, oftentimes in like our everyday conversation, when we reference like masculine or feminine, we're usually describing that in terms of attractiveness, and there's a value judgment placed on it as like good or bad or better or worse. That is not what we mean when we use those terms when describing like the skeleton. Basically what we're saying is, here's a feature. The typical female state looks like this, and the typical male state looks like this. So we use the adjective that goes along with it, masculine or feminine. That's all it's describing. It's just saying you're part of this particular category or this particular category. If, let's say, you are a female and I'm looking at 10 features of your pelvis and 9 out of 10 basically fall into that female category, but one looks a little more intermediate or possibly even slightly into the range of like a masculine trait, which can happen sometimes. Like, it doesn't mean that suddenly that the female attached to this pelvis looks like a man. Like, I just want to make sure that you guys are understanding this, right? Those things are unrelated, right? In fact, most of us will have, some random feature of our body that, if you looked at just that one feature, you might say, oh, that's kind of neutral or in the middle, because we have so many, right? If you have 100 features on your body that can determine male versus female in terms of morphology, 1 or 2 are bound to just kind of be neutral or in the middle. So keep that in mind, right? Okay. Next slide. Oh, good. So now moving on to, wait, hold on. Did I skip? No, okay. Now moving on to the skull. I already see we're at over half hour. No surprise, this one's going to be a bit longer, but we don't have too many, just a few more slides. So now going to the skull. We have 1, 2, 3, 4, 5, 6, looks like 7 or 8 that we'll go through. Do I have the mandible? Oh yeah, okay. So let's go through these. The first one, the eye orbit. The shape of the eye orbit. In females, it tends to be a little more rounded, and in males, it tends to be a little more square. Now, if you're looking at the image on the PowerPoint slide, you're like, okay, I kind of see what she's talking about. It's not going to be super obvious and like, whoa, major like circle and major square. But statistically, when these are examined, females do have more of a circular eye orbit and males do have more of a square. Let me see these two individuals if we can see, if we can see a difference. Even just with our human eye. This is the female, this is the male. See, I'm not really seeing it with my human eye, but statistically we know it's true. And like I said, variation. These are just one male and one female example. In the lab, I'm going to pull up more male and female, so this trait will be a little more obvious to be able to observe. The next one, the orbital margin. So literally, you take this edge, you're literally like feeling the edge of this, the frontal bone right here. You're feeling the edge. Does this edge feel sharp? Like not really, you're gonna cut yourself, right? Does it feel kind of sharp? You're most likely looking at a female. So you could have, let's say you don't have the full skull, you have just a fragment of the eye orbit. and you think, am I looking at a male or a female? You feel that edge, and definitely in class do this, feel the edge. You will feel the female feels a bit thinner and sharper, the male is thicker and more rounded. The next feature, the superciliary arch. Superciliary arch. So in human males, this area right above the eye, remember, for the frontal bone, one of the features you needed to know was the superciliary arches, right? Remember that? So we're coming back to that. So here we have this area. In the male, this area is definitely more raised and protruding, more rough looking, right? And you can see this on this individual. You can see it from the front, from the side, you can even see how it's protruding out, right? This is a very classic male feature. Females, typically there's nothing protruding, right? You can see just the vague imprint of a slight curvature right there, but it's essentially flat. So that one feature, males, it tends to be more protruding, more projecting, larger, rough, rugged looking. Females, not as much. And then the next feature, oh, here just on the next slide is just an image of my head. You can see very, very flat in that area. The next feature, what's called the mastoid process, the mastoid process. So hold on, let me see. Here we go. Right behind the ear, so here's the ear hole, right? Right behind the ear is this feature called the mastoid process. Recall, this is one of those features that you needed to know before when we were talking about the skull. So the mastoid process, you have a bunch of muscles that come up from your neck that are coming up and attaching behind your ear. If you are a male, those muscles tend to be much larger. So this area of the bone where they're attaching to, that area of the bone is going to be much larger. So here you can see on the female, the feature is there, right? You can see it. It's nice and rounded. It's protruding down from the skull a tiny bit. But now, look at the male one. Massive difference, right? So here it's hanging down like 3 times as far. It's definitely wider. So massive difference because the muscles on the male that are attaching to this mastoid are much larger. The next feature, so we're looking at the mandible now. The mandible, okay. So here we have, here's the female, here's the male. You can see some differences, right? So the first thing is that the shape of the chin, and this actually have a really good example here. The female, right here, female chin tends to be a little more rounded and kind of comes to more of a point. The male one tends to be a little more squared off. These are actually very good examples of that. More squared, a little more rounded and pointy, like at the front part, right? Go to the next slide and you'll see more about the mandible. So this angle, so here we have, remember this is called the ascending ramus. The ramus angle, like this angle here, once again, more open, more wide, female. If it's more obtuse, you're looking at a female. If it's more of a right angle, you're looking at a male, right? So sometimes you might see the female, it's super slanted. Sometimes males, it's a super right angle. And of course, a lot of us are kind of somewhere in between, right? So what we call the gonial angle. Those are just the 2 I have on the list for you. There are more things, like as an example, this area of the mandible called the gonion, which is why we call it the gonial angle. You can see here, even the rough and ruggedness of this area is protruding more, right? There's kind of this like flaredness out, it's kind of flaring out, right? The female, there's like none of that, right? It's very smooth. So the area of muscle attachment, once again, in that area is more obvious in the male, and the female tends to be a little more gracile. And then the next slide, the nuchal region. So the nuchal region, just a fancy way of saying like the back of the head. So for the female, the back of the head, obviously we have muscles too, right? So some of our muscles are coming up and attaching. Think of like the muscles of the back. Those are coming up and attaching to the back of the head. So there will be some slight like rough and ruggedness to the back of our head for those muscles. But in the males, once again, of course, it's going to be much more rough and rugged looking. You can see here the massive difference, right? And you'll see in the image I have that sometimes in a male, if the muscles are large enough, you will actually get this little hook feature. Basically, the body is creating more bone for that large muscle to have something to attach to. So here you can see kind of maybe the beginnings of something like that in this male, but I've seen some males where it's literally this whole thing is just a giant, like overarching, like protruding hook because those muscles are so large. Okay, and then the next slide. Oh, perfect. So this is what I was already saying, but you can see I have a slide dedicated to it. So this idea of whether a trait is masculine or feminine, that's unrelated to the attractiveness level of that individual. So here I have two individuals you'll probably recognize, Emily Deschanel and Olivia Wilde. Hopefully those aren't too old of references, but even if you're like, oh, I'm not sure who they are, that's fine. You can still look at these pictures and see what I'm talking about. They both have a very, what we would call a masculine mandible. They both have a very kind of squared, right angled mandible. This changes nothing about the attractiveness of these two women, right? It doesn't suddenly make their faces look ugly, right? That's a very subjective, that's opinion based. All we know is that if probably we had their mandible, we would see, oh, probably a little bit more of a right angle. So just like I was saying before, you never want to look at just one feature. You want to look at all of them together, because you could be a female and everything about your skeleton that says, oh, clearly female, but you might have the occasional feature that just happens to look a little bit more like the masculine trait. It's unrelated to attractiveness level. And also, to make this other point very clear, this is not the same thing as if you are, as can happen in very, very rare circumstances, being born intersex. That's a completely different topic, right? If you have questions about that in class, we can talk about that, but that's not this at all. This is just natural variation exists for everything. Every feature we can think of, there's going to be variation. And looking at females, you can see there's variation within. Oop, I think we have a visitor, someone trying to come in. Hold on, I might cut this short. Let me see. Oh, I still have a few slides. Give me 1 second. Okay, they left. I don't know who it was. Okay. Okay, so let's move on because we're at 45 minutes and I still have looks like a couple more slides. So I'll just go through these very quickly. The next area is about pathology, and these are just some of the ones that you might want to know for this class. The first one is osteoarthritis, so DJD or degenerative joint disease, but saying osteoarthritis or DJG is fine. So you can see, you guys know this one, right? General wear and tear in certain, joints like the knee or the hip. Just as you get older, there's more wear and tear, and or if you work in a certain occupation where there's more wear and tear. So you would have just someone's femur and know, oh, they're probably older, or they worked in this, probably this profession or something like that. The next one, cribra orbitalia. So in the upper part of the eye orbits, there's often this like porosity. This is very distinct when this individual has a B12 deficiency, vitamin B12 deficiency. The next one, osteomalacia. So recall we talked about this one before. Ooh, okay, I'm just gonna cut this one. We're gonna cut this one.